Welcome to This Week in Health IT News, where we take a look at the news that will impact health IT. This is another field report where we talk to leaders from health systems on the front lines. My name is Bill Russell, Healthcare CIO Coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. As you know, we've been producing a lot of shows over the last 3 weeks, and Series Healthcare has stepped up to sponsor and support This Week in Health IT. And I want to thank them for giving us the opportunity to capture and share the experience, stories, and wisdom of the industry during this crisis. If your system would like to participate in the field reports, it's really easy. Just shoot me an email at bill@thisweekinhealthit.com. Now, on to today's show. Today's conversation is with Chief Information Officer for NYU Langone Health, Nader Merabi. Good afternoon, Nader. Welcome to the show. Appreciate it.
Hello. Appreciate having me on the show.
Well, thanks for taking a few minutes to meet with us today. I know you're really busy, so I really I will have you back on the show because there's so many things we could talk about. You guys are doing so many creative and fun things in the digital space that I think would be interesting to talk about, and we'll get a chance to do that. But I want to do one of our field reports with you. Before we get started, though, give our listeners a little idea of NYU Langone, your reach, and where you guys are, what communities you're serving.
So we are, an academic health system located in metropolitan New York. Our main campus is in Manhattan, 34th and First Avenue, and then we have a hospital in Brooklyn, a hospital in Long Island, an orthopedic hospital, and then, of course, our main campus made out of 3 main hospitals. And then we have a very large ambulatory footprint, about 400 ambulatory location. These are multi-specialty locations, over 6,000 net employees physician, and close to 45,000 employees serving metropolitan New York and New Yorkers mainly. And then we have 2 schools of medicine. One main one we opened last year in Long Island. Some of you may know about us that our School of Medicine is tuition free, and we are the top 5 best school in the country. Then we have a very large medical research portfolio, which of scientists do that. So that's sort of our institution. It's in a nutshell.
So I think everybody knows this, and I'm tracking the numbers pretty closely. You guys are right in the middle of the surge. You have the Navy ships now off the coast. You're standing up, or not you specifically, but in New York, we're seeing these reports, turning the Javits Center into beds. We're seeing just unprecedented things. Give us a little context around what your system is doing and what's going on in the community that you serve right now.
Well, it is a big impact here, and we are seeing patients in our ED, and we triaging patients. And one of the advantage of that, we have opened in 2018. We have to open a brand new hospital, which is an all private room, and it can be immediately changed to negative pressure. So, but we continue to expand our ICU beds. We are, seeing a number of patients, triaging across our hospital, and then we got our students and residents and all the health workers work to serve the community, and our physicians from multidisciplinary, all engaged to serve the community.
So give us that. We'll delve into health IT for a second here. So actually, for the rest of the show, actually. So what's one thing you discovered in the past few weeks that might benefit others that are maybe a couple weeks behind where you guys are at?
Well, so first of all, I'm going to talk about crisis and emergency. So I know people ask me, well, what did you do? We've been, unfortunately, I've been through many crises, including September 11, blackouts, Sandy, storm, and of course this. And part of that is our institution having a good emergency planning since even Sandy and before that in place. And that's a broader institutional plan about, in case of an emergency, what to do, and we plug into that. And then when IT, we've created a structure for many years in place, but how do you deal with crisis? Now, we all know, and based on my experience, there's crises all different. So you never get the same crisis again when people thought, So the question is, how do you set up a structure to deal with the crisis with assets and be able to, react quickly, improvise as different issue arises? So this crisis is totally different than what Sandy was. Sandy was an event and happened, and then you have to deal with aftermath. This is continuing. So in such, you have to prepare your staff to dealing with this on an everyday basis. And so it's a different type of crisis. So you got to be very nimble and agile as the need changes to be able to deliver the technology services, whether that's expanding ICU, telehealth, and various other things. And the other thing is about really having your technology architecture in the way of integrated environment and capability really matters. This is where it shows as either crack or strength of how you architected your technology infrastructure. And that's puts it to real test here. Both your staff and your structure and your technology capabilities.
So what are some of the, from a leadership perspective, what are some of the things you're doing for your staff to make sure they're focused on the right things and to make sure they don't potentially overwork themselves or get into a situation where they put themselves at risk?
Yeah, so two things. One, our leadership at the top is very connected. I'm part of the senior leadership, and we meet twice in the morning and in the afternoon to make sure that we are in sync with clinicians, with our staff, what the institution needs are. And so that's very aligned that way. And then I meet with my team every day at noontime with my leadership to making sure that we are delivering and aligning our resources to deliver the right things and to focus on the right problems. So we have a very seasoned team. As I said, we've been through many crises, so everyone knows the playbook. And all part is about agility and reaction. So whether that was expanding telehealth, which we invested before, and all of a sudden that really paid the dividends, or having thousands of people working from home, and now we can service them and set up a quick triage and command center so we can really help people to be productive, or making sure that we partner with our vendors to get the equipment we need or integration points we need, and having them prepared to help us. So a lot of these, again, it requires the structure and investment you make a long term. This is where you see the dividend pay off, the readiness. And I always see people that you always have to be ready for a crisis. It's too late when you're trying to get yourself ready. So I think that's the message.
It's interesting to do your conversation and the conversation with Ochsner on my timeline. I just did them 15 minutes apart, and Ochsner, he just sort of looked at me and said, we have a crisis every year, if not every 2 years, because there's a hurricane waiting to hit New Orleans. He goes, so yeah, we had capacity, we were ready, and you just rattled off, from 9/11 till today. There's been a fair number of things. But what specific solutions have you put in place that others may benefit from? Is there a specific solution that you think is relatively creative for that others could consider?
So several things about telehealth. I touched base. Our telehealth, we had invest a lot on digital, and that's just not telehealth, but digital. So that it was clearly we pushed a lot of video visits. So both are not only we had a virtual urgent care already in place, but the volume went up really crazy, and we had to prepare our clinicians to matriculate. And so the technology we built was very easy. It's Uber-like, a physician can go and take a shift and be virtual, and we prepare. So we wouldn't expand a lot of physicians who can do a virtual session. And then also on the ambulatory side, we moved a lot of visits virtual, and part of it's because of the reimbursements is feasible. And then serving our patients in the communities who don't want to come to the doctor's office, and we really booking a lot of video visits, and our volume went up thousands-fold, which is great for community and our physicians to be, serving our patients and their family. On the inpatient side, being able to use telemedicine, both between physician to physician consult and in the room, which we're deploying. And then because we have such an integrated EHR, we have one EHR across our health system, really making all the protocol changes and that the whole health system gets that in one go. So, in that sense, we've been lucky that we've been integrated our EHR across the health system. And it's not the EHR, the entire clinical platform. It's one thing, so we have one of everything, not multiple systems in different our hospitals. So that allows us to be very nimble and we'll make a change to that. And the other piece is really analytics. I'm sure every institution leadership want the data to be able to decipher how many patients came through, what was tested. So we quickly develop a dashboard. The team is very seasoned again in analytics and dashboard. We really deliver to leadership the dashboard they need to have information at their fingertips to make decisions. So all of these things, I think you've got to, kind of move in the same cylinder and get every team resources, IT to kind of deliver these needs where your leadership needs information, needs data, real time to make decisions.
Yeah, what I was going to ask you about your build team, your EHR build team, and if they've been asked to do anything specific. And I was going to ask about analytics. From an analytics standpoint, let's delve into that a little bit. So did you, what kind of things did you put on the dashboard, and what kind of things are you being asked for in addition to dashboards from your analytics team?
Well, it's clearly how many patients come through the door, who's in ICU bed, who's in recovering, who's been tested, the condition of different patient, volume across each hospital, number of visits, ventilator counts, so slew of things that leadership want to look at it real time, every day, every moment, and to be able to have that information. So those are the main things. And then we also trending the data, seeing every day how things trends across different our emergency rooms, and then inpatient settings, and then clearly telehealth volume, and very other aspects that we are measuring. So, and we as that one interesting thing I would tell people that advise is as you're developing these dashboards, quickly deliver them metrics and add new next one. So you don't have to build all of them at once and deliver. So just as much as you can deliver and let the validate it and clearly partner with hospital operations and leadership and clinicians to make sure that the data is validated quickly and makes sense. And then, deliver these metrics every day. If you give the leadership another metrics, they'll be happy. And so don't wait to do everything, get to the main things and then keep iterating.
Yeah. Absolutely. Your build team and your build team around your EHR. I mean, there's a whole bunch of codes being thrown at us. There's a whole bunch of, potentially different screens tracking for ONC, CMS, and others and CDC who want information. I mean, has your team been busy trying to incorporate that? And what kind of work are they doing right now?
The team is very busy. One, we try to, first of all, we most focus on how we serve our patients and listen to our clinician, their needs about what kind of information they need on our EHR screen. So we deliver the integrated screen that has a good level of information. One of the things a good preview that our physician also work on the floors now. They're doing shifts. So it's getting good information inside about what's happening and what people looking for information and what are some of the things that we can adjust. So that's been very helpful because these are our clinical implementation and implementation part of IT is actually also doing shifts on the floor. So that's, and also doing some of them telemedicine visits. So we're adjusting. And then we continue to, again, work with states and federal government and making sure that we're providing the data we need and also our EHR vendor as well.
Yeah. I mean, when you're in the thick of it, it's important to be focused on the clinicians, on the patients, and serving them well. Last question, and I appreciate all the time you've given us. What's one thing in the prep process that you wish you had done earlier on? There's some systems that are getting ready for a surge, and maybe they have a little bit of time to do something at this point. So is there one thing you wish that you had done maybe earlier in the process?
And I'd be very honest, and I know it sounds, a little strange, but no, as I said, we've been having this structure in place, so we exactly knew when we connected how to start, organizing team, reacting, and making sure that people understand, and then also, taking care of the employees themselves and making sure that they have access to the system, and they're safe. So I think that you have to be prepared. You have to have a structure. So if you have not have a structure in place about communications, we also make sure that you have in that place so you can communicate very rapidly with your team. And there's a structure. So one thing I would advise people, if they have not that in place and they don't know, how do people get engaged, how the information gets disseminated, how do you communicate? So, for example, when we prepare for people working from home, some non-essential staff work from home. Of course, our clinicians working in the hospital. We immediately have to give people information about, hey, if you're using your computer from home, this is a helpful hints and tips and how to use WebEx effectively. We kind of disseminate information very quickly to people so that, some people may not have used WebEx or Zoom technology in a while, and we have to send them quick tips. Also, a lot of these sessions get very large, and people have a different way to manage. And okay, how do you meet people quickly so that people can hear? There's like little things that actually people really appreciate that you kind of give them a hint before. So I have those things, information prepared, so that you can make people stay productive. So those are some of the advice I give. But you have to have a structured place.
Yeah.
If you don't have an emergency call number that everyone can get on and in second notice, then you have a bigger problem. So for us, if I wanted to get my leadership on a call, there's no, here's the number. People know it's an emergency call, a P1 we call it, and everybody gets on the call.
Yeah.
It's in everyone's program, everyone's foreign calendar.
Again, I think you guys have benefited from, it's hard to say you've benefited from going through disasters, but you do benefit from going through them and learning things and being prepared for these kinds of things. And I appreciate you bringing that experience into this crisis and being a part of sharing that with the audience. I really appreciate it. Thanks,
yeah, my pleasure.
Really appreciate your time.
My pleasure. Thank you.
That's all for this show. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, HealthLyrics, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email, DM, whatever you do. You can also follow us on social media, subscribe to our YouTube channel. There's a lot of different ways you can support us, but sharing it with a peer is the best. Please check back often, as we will be dropping many more shows until we flatten the curve across the country. Thanks for listening. That's all for now.